non-profit organizations. Henrietta ji has worked and contributed a lot in the field of economic development, education, health, humanitarian assistance, and disaster relief. Now I request Henrietta ji to address the August gathering.
Thank you very much. I am delighted and honored to be here. On behalf of UNICEF staff members worldwide, it is a pleasure and an honor to discuss with you the next steps in our journey together as we translate our dream of total sanitation into a reality for every family and for every child. We have much to celebrate, but more importantly, we have much to do. The journey is the most difficult, but it is also in this last mile when our hearts want to quicken the pace and reaching the goal is within our sight. The good news is that within our successes, embedded in the progress we've made over the decades, are the seeds of our future progress, our future successes, the lessons learned that will light our path in the years ahead. The progress countries have made in recent years is inspiring. Look at the region we're in today. Over the last decade, South Asia has seen the greatest increase in the use of toilets than at any time in history, with over 240 million people using them and abandoning open defecation. Part of this progress has been driven by our conference's host, India. Since 2014, 86 million rural households have gained toilets for the first time. 500,000 villages and hundreds of districts and 21 states and union territories are now open defecation free. It's an exceptional accomplishment. We're also seeing rapid results in Indonesia, Ethiopia, Nepal, Cambodia, all on track to eliminating open defecation by 2030 or even earlier. Or Nigeria, Kenya, Niger, Burkina Faso, Togo, Mozambique, all have national roadmaps to deliver total access to sanitation, no matter where people live and no matter how distant or hard to reach the communities that they might be. In all, since 1990, 2.1 billion people globally have gained access to improved sanitation facilities. It is a great result, one that improves health and nutrition outcomes for children, empowers women, and boosts economic prosperity and growth for entire nations. As we recognize the human and social costs for poor sanitation, we must also think about progress. We must face the difficult fact that without urgent acceleration of our efforts, many countries will not reach the 2030 goal of sanitation for all, especially when 1 in 3 people, 2.3 billion in all, still lack even a basic sanitation service, when 12% of the world's population still practices open defecation, or when nearly 1/4 of all schools worldwide lack basic sanitation, risking the health and lives of over 620 million children. This is obviously a tragedy for the people affected. The children in rural areas or urban slums have no choice but to practice open defecation because their communities lack basic services. Those who risk poor health and disease. Those children who are stunted by malnutrition in the earliest years, or girls who are denied an education because their schools lack separate toilets or proper sanitation. And as always, the poorest and most disadvantaged are the hardest hit. Lack of sanitation unfairly puts them at greater risk of disease and even death. We must see the economic cost as well. According to the World Bank, poor sanitation results in an estimated GDP loss of $260 billion annually because of health costs and productivity losses. On the flip side, the benefits of improved sanitation are significant. A recent study by the government of India found that in open defecation-free environments, households can save up to 50,000 rupees per year, thanks to saved medical costs that were averted and time that was saved. So the stakes are huge for people and countries alike, which is why this conference must be about more than celebrating progress. It must be about what we are going to be doing next, how we're going to urgently accelerate results for those people still left behind in this progress. At UNICEF, we've developed a specific time-bound target. By 2021, our goal is to have 250 million fewer people practicing open defecation. This means improving sanitation in all the countries where we work, and we are committed to this. But we also know that 90% of those still practicing open defecation around the world live in 26 specific countries. To accelerate results in those places where the burden is greatest, we've developed an initiative called the Game Plan to End Open Defecation. Through it, we're working with governments to develop roadmaps to eliminate open defecation by 2030. Building on what we've learned so far and what has worked so far, we're focusing on 3 key accelerators: community-based approaches to sanitation, involving children, young people themselves in our work, and unleashing the power of public and private partnerships. So first, community-based approaches to sanitation. For the last 20 years, community empowerment has been at the heart of our progress. The countries and communities that have made the most progress understand the most important key to success: creating demand. Progress isn't just about building more toilets. It's about making sure that people are using toilets by changing behaviors, and that they understand why it's important for their health and for their children's futures. As community demand grows, local governments and decision makers have a powerful political incentive to invest in this issue and ensure that every community, from rural villages to crowded urban areas, have effective sanitation systems along with safe water supplies, which is why UNICEF and our many partners support the CATS approach, community approaches to total sanitation. Beyond creating local demand for sanitation, we're also working with governments to help them integrate hygiene and sanitation across local systems for nutrition, health, and education, as Burkina Faso is doing, for example, by providing more hand-washing facilities in schools and soap in hospital delivery rooms. And working with people within these communities is also critical. Community engagement and community action must be at the heart of our work. In South Sudan, UNICEF is working with women in communities to train them how to install water taps, build new latrines with separate facilities for men and women, and ensure that these facilities are well lit with street lamps. In the words of one local woman, "When the women here feel like they are participating and their voices are being heard, it gives them hope that things will continue to improve." So we must find more ways to involve people at the community level. Which brings me to my second point. We must put a particular focus on involving children and young people in our work. Young people not only represent the future of our world, they are powerful agents of change in their communities today. In India's Kabiram district, 138,000 students from over 1,700 schools wrote letters to their parents to request toilets to be built in their homes. The result? Sanitation coverage in the district increased by 25%. Young people are also on the front lines of sanitation progress in other countries too. In Sudan, young leaders in IDP and refugee camps are being trained in sanitation and hygiene promotion. They're not only helping to keep their family and friends safe and healthy during an emergency, they're learning valuable skills and knowledge. And in Nicaragua, UNICEF is training adolescent girls and boys as masons to help construct water and sanitation facilities in their communities and schools. In fact, we should be using water and sanitation as an opportunity to help more young people in more communities gain vital skills and knowledge that they can carry with them in the years to come. As sanitation increasingly becomes a social norm in every city, every village, and every rural community, demand for quality, well-managed systems will grow. And according to the Toilet Board Coalition, the market for toilet-related products and services in India is predicted to double to 62 billion in 2021. A significant opportunity as young people consider their job prospects when they enter the workforce. And my last and third point today, we must unleash the ideas, innovation, and market reach of the private sector across our sanitation work. Businesses have long played an important role in UNICEF's work, from our collaboration to drive down the price of vaccines, to the food industry's development of ready-to-use therapeutic food, to the new rapid diagnostic tools being developed to fight diseases like Zika and pneumonia, to India's Mark II hand pump, the most widely used in the world. Reaching our sanitation goals means applying the same collaborative approach. In Bangladesh, a great example is emerging: Sanitation Market Systems, or SanMark-S. It's bringing together the expertise, resources, and innovations of the public and private and development sectors to reach more rural households with improved sanitation. Manufacturing firms are mass-producing low-cost, quality latrine parts and working with small local companies and installers to market them in low-income households. For the poorest households, this project includes a subsidy. So far, over 95,000 latrines have been sold, and more than 500 local entrepreneurs are being trained and mentored in both the installation and marketing of these products. It's a great example of how we can work together in a shared value partnership, one that benefits economies, people, and entire communities. Ladies and gentlemen, these are just a few ideas of how we could accelerate our work for millions of people who are being denied sanitation. Changing behaviors, constantly improving our products, operations, and maintenance, giving young people a chance at a livelihood and maybe a business of their own, drawing more partners, ideas, support, and dedicated national resources to our important cause. We look forward to hearing about your ideas today as we take our next steps in our journey together. And in the words of Mahatma Gandhi, the inspiration for this movement, the future depends on what we do in the present. As we convene this week and in the future, let us be guided by that same spirit. Thank you very much.
Thank you, Henrietta ji, for your insight and ideas regarding sanitation. You beautifully highlighted the importance of SDGs. Now I invite the Honorable Chief Minister of Maharashtra, the dynamic leader, very young leader, and what he achieved in sanitation is almost impossible. In 68 years, the Maharashtra's achievement in open defecation free was 40%, and now it is 100% in 2 years. So we must give him a, yes. Devendra ji has propelled Maharashtra to the open defecation free status. Let us hear and learn from Devendra ji how he encouraged the rural sanitation coverage of Maharashtra from 49 to 100, how the massive behavior change campaign was implemented in Maharashtra, which resulted in making the state open defecation free. Now, Devendra ji.
Thank you, Madam Uma Bharti ji, Madam Henrietta H4, Executive Director of UNICEF, all the excellencies and dignitaries present here, ladies and gentlemen. this is indeed an honor to be a part of this Mahatma Gandhi International Sanitation Convention. Tomorrow is 2nd October and we'll start celebration of 150th birth anniversary of Mahatma Gandhi. Mahatma Gandhi ji did not just give us political freedom, but he was instrumental in giving us freedom from many evils. And he was instrumental in starting a cleanliness drive across the country as a part of freedom movement, because he always believed that we are sure to achieve freedom one day, but it is important how do we make and shape this country. And he always used to say, cleanliness is next to godliness. And if you really want to worship God, God also wants clean heart, clean mind, clean body, and clean environment. He was one person who himself nearly every day used to do community cleanliness work and used to inspire thousands and thousands of people. After our Prime Minister, Shri Narendra Modi ji, took over in 2014, he set audacious target, what it seemed audacious that time, of making India open defecation free by 2019. In fact, many believed that it's like any other announcement. But first thing in the journey towards ODF and sanitation is a leadership which can inspire people. All of us know that no such program can attain success without people's participation. We have to make it people's movement. And when every single Indian saw our own Prime Minister taking a broom in his hand and cleaning places, it became a revolution. And everybody, every single citizen started setting up a goal for himself. So I think unless we inspire people, unless we take their participation, we are not able to achieve this. And as a government program, we may create a lot of sanitation infrastructure. We may construct toilets. But what if nobody is using them? I come from a city, Nagpur, which is second capital of my state. Mumbai is my state capital. And in Nagpur, we always used to go to an area called Barakholi. Barakholi is 12 rooms. And I never knew why it is called Barakholi, why it is called 12 rooms. Then one day, it was revealed to me that some 2-3 decades back, in one of the government's program, 12 toilets were constructed there. And people that time said, why do we need toilets? There is so much of open space, we can go there. So they destroyed the seat and started using those toilets as their rooms to dump whatever they had. And that is why it was called Barakholi, 12 rooms. So, unless there is a participation from people, we are never going to achieve that. So in the state of Maharashtra, and let me tell you, it's second largest state after Uttar Pradesh, with a population of 120 million people. And although it had always been a very forward-looking state, with a lot of industrialization, and today it contributes around 15% to the national GDP. It's a powerhouse, but such powerhouse was totally lacking in sanitation. And as rightly told by Madam Minister, the entire coverage of sanitation was 45%. Not a single city was ODF. Not a single district was ODF. The smallest unit, which is taluka, not a single taluka was ODF. And there was this huge target before us. Our Honorable Prime Minister had set a target to make India open defecation free by 2019. So we said that if Maharashtra cannot do it, nobody will be able to do it. We set a target of 3 years for us. And we said we will finish it off in 3 years. And we started with community outreach. The first thing which we did was lot of community outreach. Every single government official, every single public representative was requested to go to the villages. There are 40,000 villages in the state of Maharashtra. We sent people, we decided that in first go, we will reach 2 million families and make them aware what they are losing without sanitation. We'll take their help, and with their help, we'll construct toilets. And we could reach 2 million families in 3 months. And we had such an interaction that the entire participation started. And in first year itself, we could construct 1.7 million toilets. And in the last year, we constructed around 2.2 million toilets. In total, we have constructed around 6 million toilets. And if you look at the work which we could do since our independence, 1947 up to 2014, we could construct 5 million toilets, and in 3 years, we could construct 6 million toilets. In the urban area, in the rural area, we also constructed around 300,000 community toilets, and in nearly 2.5 years, urban Maharashtra became ODF. In 3.5 years, rural Maharashtra became ODF, and the entire Maharashtra, after a long process of assessment, was declared ODF. And our challenge, of course, was creating the infrastructure which we could do, but that also helped our economy because it created a huge opportunity for creating jobs into all sanitary wares. New type of toilets were invented where less water is required, which are easy to clean. A lot of innovation went into it. In the rural area, people started innovating and they started coming to us that our model is better and you adopt this model. A massive drive to train people, masons and all workers into this was taken up, and that created a lot of jobs, and I think that has helped our economy as well. And secondly, that has enhanced confidence in the mindset of people. Even in the rural area, now they have seen the transformation. They know we can transform. And today, when the second biggest program of our Honorable Prime Minister is on, where we have set a target to provide house to every single Indian by 2022, hopefully with this drive and with this confidence, Maharashtra will, at least in the rural area, be able to provide house to every single person much before 2022 and possibly by the end of 2019. Once people start changing their behavior, they start to act differently. And the major issue was sustainability. Now, in most of the areas, it is more than 18 months that the ODF is active, and we created several activities, outreach activities, to enable people to use these toilets. Good morning squads were created, where in many cases, kids going to school started going on the streets with a whistle, and if they found somebody not using a toilet, they would just blow a whistle to shame the person. And since they were kids, nobody could fight. Many such innovative ideas were started. Every single village panchayat was given a target to set a plan of sustainability, and the state promised to help in sustainability. We also created a lot of awards into sustainability. I think last year we have given awards worth around 40 crore rupees to different local bodies for the sustainability into sanitation. And I must say that there has been huge response in the national ranking. Out of first 100 cities, 28 cities are from my state. Many districts are from my state. And I think it has also helped, as rightly told by Executive Director, we have been experiencing it. After creating toilets in schools, girls have started going to schools more. The dropout rate has come down. They want to attend the school. So there is a huge cascading effect of creating this sanitation. Now we have moved forward, and on one hand, clean water to every village under the leadership of our Honorable Minister, who has been kind enough to give us a lot of support in getting a clean water reach every single village. And now cities and villages are focusing more on solid and liquid waste management, which also is one of the major issues. And I think with the new zeal in people, with the participative approach, which was always theme of Honorable Mahatma Gandhi and now theme of our Prime Minister, Shri Narendra Modi, I think we'll be able to achieve this. So I once again thank you all for gracing this occasion and giving me this opportunity to tell you the story of state of Maharashtra. Thank you.
Thank you, Devendraji, for sharing this interesting journey on the sanitation movement in Maharashtra. I fully agree that sanitation leads to economic prosperity of poor and marginalized, and Maharashtra model stands to inspire many. I thank Henrietta-ji and Devendraji for joining us and sharing with us your insight and ideas on Swachh Bharat and the Sustainable Development Goals. Let me close by saying that sanitation must be prioritized and put firmly on the top of the development agenda. Leaders should ensure that their whole nation, including central and state governments, public sector enterprises, private sectors, and all other stakeholders work together for this noble cause, so that the difficult task of eliminating open defecation from the world may be achieved well before the target deadline of the Sustainable Development Goals in 2030. Thank you very much.
Thank you very much. Ladies and gentlemen, we now take a break for tea, which is arranged outside, and after which we will be moving to the assigned rooms for the parallel ministerial dialogue sessions that will last until 1 o'clock. 50 ministers have been divided into 5 groups for the parallel sessions that are designed as dialogues with participating ministers and global experts in the field of building political opinion for sanitation, ensuring adequate financing, and taking strategic measures to work at scale and reach universal access. Each group has a moderator and a coordinator to conduct the session. After tea, to the specific room on this floor as well as 1 floor below. Hall numbers 1 to 4 are on the 1st floor. Hall number 5 is on the 2nd floor, which is this floor. Please go to the assigned rooms. In case you do not know which room to go to, please refer to the screens. We've got signages outside as well that tell you all the information regarding these groups. Tea and refreshments.